Good evening and good health, my fellow Long Islanders. Welcome to the Flu and You, What You Need to Do, a conversation with the Suffolk County and the Nassau County Commissioners of Health. This program will be closed captioned in English, recorded in English, and the Spanish translation will be available in real time in the Zoom chat. The post-event recording with closed captioning and Spanish translation will be available on YouTube. To access closed captioning in English, navigate to the bottom of your Zoom screen. Click Closed Caption on the right side, and then click View Full Transcript. To access Spanish translation, you will see it come through in the chat.
Para ver los subtítulos en español, navegue a la parte baja de su página de Zoom y seleccione Chat.
Thank you. I am Dr. Lisa Ben Scott. I serve Stony Brook University as the director of the program in public health and as professor of health sciences with a primary faculty appointment in the School of Health Technology and Management. Tonight, I have the privilege of moderating this conversation with the leading public health experts for Long Island. This event is co-sponsored by the Suffolk County Department of Health Services, the Nassau County Department of Health, the Stony Brook Program in Public Health, the Department of Family, Population, and Preventive Medicine in the Renaissance School of Medicine, and the Stony Brook University Alumni Association. I also must thank our planning committee leaders, Dr. Cordia Beverly and Ms. Yvonne Spreckles, for their immense contributions to plan what we think will be an excellent program. I am joined by my colleague, Dr. Hector Alcala, an assistant professor in the Department of Family, Population, and Preventive Medicine and core faculty in public health, who will translate from English to Spanish in real time throughout the program. We are delighted to introduce our Long Island public health experts. Dr. Gregson Piggott is the Commissioner of Health for Suffolk County. Prior to his position as commissioner, he served as director of the Office of Minority Health for the Suffolk County Department of Health Services since June 2009. Dr. Piggott has also served as the medical director for the Suffolk County Emergency Medical Services and as a physician in the Huntington Methadone Treatment Program, providing the most widely known medication-assisted treatment to county residents suffering with opioid use disorder. He completed his residency training in internal medicine at the Cambridge Hospital in 1997. He is board certified in internal medicine. Thank you for being here with us tonight, Dr. Piggott.
Thank you, Lisa.
Dr. Lawrence Eisenstein is Commissioner of Health for the Nassau County Department of Health. Dr. Eisenstein is board certified in infectious diseases. He served as president of the New York State Association of County Health Officials and is now on the board of directors. Prior to becoming commissioner, Dr. Eisenstein joined the Nassau County Department of Health as deputy commissioner back in 2009. Dr. Eisenstein completed an internal medicine residency, chief residency, and fellowship in infectious diseases at Winthrop University Hospital in Mineola. Both commissioners are affiliated faculty with the program in public health at Stony Brook Medicine and are clinical assistant professors in the Department of Family, Population, and Preventive Medicine in the Renaissance School of Medicine at Stony Brook. Welcome, Dr. Eisenstein, and thank you again, both of you, for being with us this evening.
Thank you, Lisa.
Commissioners, the questions I'm going to pose were submitted during registration by attendees and members of our planning committee. I think they will challenge you tonight. Nearly 300 Long Islanders registered to participate. And so we will begin with opening remarks in response to this first question. How concerned are you about the flu on Long Island this year? And why is flu vaccination so important to protect the health of residents in Suffolk and also in Nassau counties? We'd like to begin with Dr. Piggott and start us off with Suffolk County.
Very good. Good evening, Lisa, and good evening, everybody. So as to why we are concerned about the flu, because it happens every year. So it's usually around December, January. All of a sudden, the hospitals start getting full. Whether it's Stony Brook University Medical Center, whether it's Southside, Good Samaritan Hospital, but the hospitals in Suffolk County start getting full, and it's a lot of what we call influenza-like illness. And we see it every year, whether it's pneumonia or whether it's the flu. And so that we know the colder days are coming. And as in previous seasons, we expect the numbers of influenza-like illness to start to spike. Add that now combined with the COVID-19 pandemic, which is also a respiratory virus, and we're in a potential load of trouble here and in this coming flu season. Generally, as it gets colder, the flu starts to hit sometime in November and usually peaks in January, February. So we need to get prepared for that season that's coming up ahead.
Thank you for your remarks, Dr. Piggott. Dr. Eisenstein, what are you concerned about with regard to the flu in Nassau County?
Well, I think Dr. Pickett hit it right, talking about hospital capacity and how we know that this is something that happens every year. But if you're asking what I'm concerned about, I'm concerned that people are going to die. And in public health, our mission is to prevent illness. And with flu, think about with COVID, which, is something that it now took 15 seconds before I said the word. I mean, it's so on the forefront of everything we're doing, even here at a flu presentation. With COVID, we're all praying for the day when there's a safe, effective vaccine so that we can get back to our lives. Flu kills thousands of Americans every year and many thousands of people around the world. And there is an effective, safe vaccine. And I think that's really important. The number one thing you're hearing about COVID vaccine is, will it be safe? Will it be safe? Will it be safe? And there are a lot of people saying, oh, I'm not getting it until I know it's safe. The flu vaccine has been given billions of times, not millions, billions, and is proven to be one of the safest vaccines that we've ever made. It's proven to have saved thousands and thousands and millions even of lives. And so my concern is we have a means of keeping people from getting ill and potentially keeping people from getting critically ill and even keeping people from dying. I want to make sure that our residents take that opportunity so that if flu does come, we don't know every year what the flu season is going to be, but we do know there will be some flu season. There's no reason that people have to die from it. Every year, thousands of people die, and the overwhelming majority of them were not vaccinated. Mm-hmm. And so I see that as an opportunity for public health to improve health outcomes.
Thank you both for your opening remarks. Let's spend a few minutes helping all of us really understand what is the difference between influenza and COVID-19.
Flu's been around for at least a century, more than a century. It's something that the human body has seen. It's something that the human body knows how to deal with and fight off. There have been effective treatments, antiviral treatments for the flu. And as Dr. Eisenstein was saying, there's been a vaccine that's been given out billions of times to help prevent the flu. COVID-19, or they call the SARS-CoV virus, is relatively new. It only started appearing on the scene in December of 2019 in China. And so the body has not really seen this virus. We've already seen the devastating impacts of this COVID virus. And because it's something brand new and that we really have no natural immunity to or herd immunity to. It's something that we're adjusting to and has already caused tremendous morbidity and mortality, deaths already. So it's something that we need to be concerned about.
Dr. Eisenstein, would you like to add to what the differences might be for walking around? You've got a cough, you've got a fever. What is it? Is it the flu? Is it COVID?
Well, there are differences, and they're essentially two different species of virus. I mean, if you're going to look at it that way, and you cannot just assume that what will work for one will work for the other. And I think, however, there are also similarities in that they're both respiratory viruses. They both can be transmitted through similar mechanisms, and early data is showing that maybe the mechanisms, that the protective measures that we're taking with regard to masks and distancing, it would seem flu circulates the globe, and during our summer, when it's not flu season, the Southern Hemisphere tends to have their flu season, which starts there and comes to us. And it looks like they had a very mild flu season, and that's being potentially attributed to all of the protective measures. So the measures that we're taking to prevent from catching COVID, hopefully will also work to help us from preventing flu. So there are some differences, and Dr. Pickett talked about that. And I also think there are some similarities which may work to our favor, but sometimes they're too similar. And so, you know, the general flu symptoms can look alike. And so they're very generalized. It could be fevers, low grade. There's hundreds of things that can cause fevers. It could be runny nose. It could be achiness. It could be gastrointestinal distress. All these generalized symptoms. And a concern that I have that I wanted to share is we've now had 3 confirmed cases this week where people went to their doctor with those symptoms, and doctors attributed it to getting the flu vaccine the day or two before and did not test people, and they turned out to be positive a few days later when symptoms persisted. And so my fear is, in a lot of ways, they're too similar, and we absolutely should not be attributing generalized symptoms that could be COVID to having had received a flu vaccine prior. We know when people get a flu vaccine, they could have a little bit of achiness and a little bit of low grade, could have a short-lived low-grade temperature, but that should not be mistaken for symptoms that could be COVID. And we don't want anybody taking chances. So this is a new trend that's occurred this week. And good news is people are getting their flu vaccines. The bad news is that we don't want anything to be a barrier for people getting tested for COVID.
Does the flu vaccine protect against COVID-19?
No, the flu vaccine protects against the flu. It has nothing to do with COVID whatsoever.
Thank you. That was a question from our audience. Appreciate that clarification. Are there tests for COVID-19 and the flu?
So they're working on testing machines. There are currently testing machines that could test for COVID or the flu on the same test, but right now you need different medium. And the world of COVID testing is exploding rapidly, and new tests are coming to the market. Soon there'll be a saliva test that you can blow into a tube and instead of the swabs in the nose. But flu testing has been around for a long time. It's relatively accurate. And there's quick tests and rapid tests for that. And there's laboratory tests to confirm. There's different strains of flu. So there are a lot of flu tests available on the market. And there will come a time, I'm sure, we already have respiratory panels where one sample can detect a number of different respiratory viral pathogens. I'm sure that there'll be a day when the same swab can, because the symptoms may be similar and we may see, we don't know, we haven't done a winter yet here with COVID, but we know flu is going to be here, as Dr. Pickett said, peaking in the mid to late winter, even if it's low numbers, which hopefully it will be. We know that will happen. It always does. It's part of nature, just like summer comes and winter comes. But I think that one day, I look forward to the day when there's testing for both of them in one shot. And even more important, you know, down the road, way down the road, some crafty pharmaceutical company is going to come up with one injection with the vaccine for both of them in one shot. So I'm daring to dream way ahead. But for right now, I'm happy that we have an effective flu vaccine and hopeful that one day we'll have an effective COVID vaccine.
How many times in a calendar year should a person get the flu vaccine? And when is the ideal time in the calendar year to do it?
The flu vaccine should be once a year. Every flu season is different. They adjust the particles in the vaccine every year, depending on what they think is going to hit in our particular area. So it should be in the late summer, early fall. So generally September or October are the best times to get that flu vaccine. Then you'll have maximum protection for the upcoming season.
Great.
I always say when I get asked that question, people say, when is the best time to get it? I say, as soon as you can get it. And I know that September and October are considered ideal. Dr. Pickett's right. But if somebody, you know, is students going back to school that last week of August, they're at their pediatrician, they may not get back for that shot. So my advice always is when you can get it for the season, get it for the season. And we don't want to miss any opportunity to protect people and get them their shots. But Dr. Pickett's absolutely right.
Now, picking up on some of Dr. Pickett's comments, how effective is the flu vaccine to prevent flu in a typical year? Is it 100% effective?
Definitely not 100%. It's variable, somewhere around the 50% mark. It could be a little higher than that. Again, it depends, because you don't really know exactly what strain is going to be the dominant strain in the region. So there's always some guesswork behind it, but it is definitely more effective than nothing at all.
And this topic, I find, as an infectious disease specialist and as a public health professional, is very frustrating, because we know no vaccine is going to be 100% effective, although most of them are highly, highly effective. And every year there's this big discussion of what percentage of perfect match is the flu vaccine. It really undermines in some ways our efforts at trying to get everybody vaccinated. So let's say in a bad year, the flu vaccine is only a 50% match, and the headline in the news is going to be flu vaccine is only a 50% match. Well, that doesn't tell the whole story. And it really undermines public health's efforts when those numbers come out without the whole story. First of all, if you can protect 50% of the population of the United States from a deadly virus, which is what, 170 million people protected, that's not a bad thing to begin with. And if right now we had a COVID vaccine that could protect half of the US population, we'd be excited as a start to have that. So I don't think it's a bad thing. As Dr. Pickett said, it's better than nothing, and there is protection. The other piece that's really important is we know with flu that there's a certain level of cross protection. So in my example, where 50% of the population is covered as a perfect match, the other 50% still gets some cross protection and have been proven to be much less likely to have severe disease. So even when it's not a perfect match, there is protection that's usually enough to prevent people from dying. And so a vaccine doesn't only have to completely prevent disease, but if it can prevent you from dying or being seriously ill, that's a success as well. So every year I cringe when that number comes out, and it really feeds the argument of people who say, you see, why should we get this vaccine? It's not a good match. I totally disagree with that. And even if it's in a bad year, 30 or 40 or 50%, A, you're protecting those people, and B, everybody else still gets cross protection and is much less likely to have a severe outcome or death. And so while it's not 100%, and until a flu vaccine comes out that is, we're going to be dealing with this, it's a discussion that I find very frustrating as the Commissioner of Health, because we work so hard. We have a vaccine that's safe and we know saves lives. We don't, any argument that comes out in opposition to it, I find undermining and very frustrating.
Well, you read my mind, because my next question to both commissioners is, what would you say to someone who is listening tonight who is not planning to get a flu vaccine this year? What would you say to that person listening in, Dr. Pickett?
My advice is to control what you can control. So you know that with the cold weather coming, you're likely, as in previous years, to pick up one of these respiratory viruses, whether it's a, common cold virus, whether it's the flu, or God forbid, if it's COVID. and you know you have a vaccine that's going to prevent you from getting the flu, so control what you can control. Get that flu shot. It will absolutely make a difference, and you will definitely decrease the likelihood that you will get sick from the flu. So my advice is to go for it. Get that flu shot.
Okay, and Dr. Eisenstein, what would you say to someone listening tonight who's not planning to get a flu vaccine this year?
I think Dr. Pickett said it right. You know, we're sitting here in the middle of a pandemic praying for the day when we have a vaccine. And then you have another respiratory virus, which is almost equally deadly. And in younger people, especially children, it's more deadly. And people debate public health officials about getting a vaccine. As Dr. Pickett said, control what you can control. And I know for me, I know why I get a flu vaccine every year. And it honestly, it has nothing to do with my role as an infectious disease doctor. When I was in college, we had a vacation plan and I got a nasty case of the flu. And for 8 days during a vacation, I lay in bed in a puddle of sweat while I was shivering cold. And the light hurt my eyes. I couldn't eat or drink anything. It was the worst 8 days ever. You feel like you're going to die. I vowed never to have another vacation ruined again. I was also very lucky at the time to be 19 years old. And so my body was able to do well with that. But if I had gotten that virus when I was in my 60s or 70s, the outcome might have been very different. Don't wait for something bad to happen to you to realize that you can prevent it. I swore I would get a flu shot every year since, and it's become my life's work in a lot of ways. But it's a shame when people, and a lot of the people that tell me they're not going to get a flu shot don't really have a good reason for it. They say, "Oh, I never do." I don't understand that as a reason. But if ever there's a time to do it, you don't want to end up in the hospital now during a potential COVID/flu twindemic, because you might end up in the hospital because of flu and leave because of COVID. I mean, you know, you can prevent a deadly respiratory virus. Why would you not want to do that? So, and you can control it. So I fully agree with Dr. Pickett.
Thank you for your comments. Now, who should not get vaccinated? I mean, we would imagine that there are some exceptions. So for our audience tonight, who should not get vaccinated, and why would that you have exceptions to a recommendation for getting vaccinated?
Infants under the age of 6 months should not get vaccinated, and those who may be allergic to some kind of component of the vaccine perhaps should not get vaccinated. I don't know if Dr. Eisenstein has any other thoughts on that.
There's very few people who should not get vaccinated. Dr. Pickett's absolutely right. You know, babies under 6 months, their immune system is not ready for it. They don't need it. It's not indicated. But other than that, there are very few circumstances with flu vaccine that it's contraindicated. Usually it's allergic or a past reaction, not a past little reaction when your arm hurt a little bit, but a severe reaction. The overwhelming majority, well over 99% of the population over 6 months qualifies for flu vaccine.
Thank you. I'd like to now move on to the topic of health disparities on Long Island. I'd like to start by directing this question to Dr. Pickett, given your years as the Director of Minority Health and Health Disparities for the Suffolk County Department of Health. Dr. Pickett, while flu vaccine rates are below recommended levels for all Long Islanders, some segments of the population are further behind than others. Can you talk us through what is happening in your county to help promote vaccine access and use for all, and especially among those groups that are the most behind vaccination targets?
For me, it's always been about messaging. Sometimes the messaging can be difficult with communities of color. And I'll say this from being in clinical practice for years, where I'd have a patient, it's like, okay, you know, we need to do some blood work today. We're going to check, see if you have diabetes. We're going to check in your kidney function, your renal function, your liver function. And by the way, you know, it's flu season's coming up. We need to get that flu shot for you today. No, I think I'm going to pass on that flu shot. You know, I've had his problems with the flu. Whenever I get that shot, I always have side effects. I feel like I get the flu every time I get that shot, so I'd rather not. And there's a frustration that I've had to deal with in clinical practice, and you know, me being a persuasive individual, Lisa, as you can see, but but it's been a struggle sometimes with communities of color to really promote that message of flu vaccination every season. And so I think it's something that we, especially as a Department of Health, are trying to do more messaging. It's difficult in this environment. I used to be out there in different community settings talking about these issues, but now we're in a socially distanced world, and so we do a lot more things virtually. But trying to do the best we can to get some messaging out about the importance of getting the flu vaccine. In Nassau County Health Department, we used to stand up flu clinics, but this is prior to the years where pharmacies started doing it. So now that we have so many chain pharmacies and pharmacists that are vaccinators now, we really try to get people to get that flu shot wherever they can, whether it's the local chain pharmacy, other pharmacies, or the primary care physician's office. But there are plenty of options out there for people to get that flu shot. So it's really about messaging this year.
Great, thank you, Dr. Pickett. And Dr. Eisenstein, please share with us a little bit about what your county is doing to address flu vaccine access, and maybe share with the listeners a little bit about how the two county health departments are different in the clinical programs that they are able to provide.
Oh, well, Nassau is just better, but that I'm just teasing. But I think it's really important to talk about, you know, Dr. Pickett talked about something really important, the role that pharmacies play. And the fact is the scope of access to flu vaccine has changed dramatically in the last decade. And Nassau County, which is geographically much smaller than Suffolk, even though our population is similar, so we have a much higher population density. We have 11 hospitals in about 450 square miles and hundreds of pharmacies which are able to vaccinate. So yet there's still an access problem. And what we've launched this year is our Fight Flu campaign. And we're partnering with community partners. And what the health department is doing is, with a few purposes, reaching to communities that traditionally don't get vaccinated for various reasons. And we did see with COVID, there are communities, particularly the minority communities, got hit really hard at the peak of it. And when we asked around in the communities, people that we dealt with and met at our events also felt that they were unlikely to, or less likely to, have a COVID vaccine when it would come out. So how does this tie into flu? Well, we don't want people to die from flu either. And so we took this as an opportunity to set up a program that's not going to be for the people who are going to go to a pharmacy or a hospital or their doctor. There's many access points geographically in Nassau County. But we know we have, after H1N1, we called it a hidden population. We know that we have people living in shelters. We know that we have people who are afraid of a government vaccine because either they don't trust the government, and our history, unfortunately, has created a lot of reasons why especially communities of color would not trust the government, or they're here and they don't want to be asked about immigration status. We want to make sure that everybody has access to vaccine. And so our Fight Flu campaign consists of a series, and we did our third one on Sunday, of bringing mobile flu delivery to communities and locations where people are less likely to go get vaccinated. So on Sunday, we did it at a Baptist church, which has, speaking with the bishop there, very low intake of vaccine historically. And so he was gracious host. During the week, last week, we did one at a food pantry. We did one at a homeless shelter. And we've got, for the next 6 or 8 weeks, a couple of dozen events. And in some cases, we end up giving out, excuse me, 20 to 25 vaccines. In some cases, it's going to be 100. We're going to do one large drive-through event. And while we're protecting people from the flu, we have two other purposes besides protecting people from the flu, which is the main purpose of this Fight Flu campaign. The second purpose is we're establishing a trust. We're reaching a population that has avoided vaccines in the past and showing them that it's safe, that it works, and that we're there as friends. We're not asking immigration status or for insurance cards or anything like that. We're showing up, we're giving a little information, asking a couple of safety questions, and giving a vaccine, and that's it. And we want people to feel more comfortable the next time we come around, whether it be for flu vaccine or COVID or whatever it is. And the other thing is, it's practice for us. If we're going to do a large drive-through flu event, although we drill year round, as Nassau and Suffolk both do, I'm sure, it will be a good thing to make sure that our team, that our logistics is up and running, that our incident command is in play, where everybody understands what their roles are. And to do a legitimate, important flu vaccine run as a precursor to what may come, because we, Dr. Pickett and I, don't yet know what our role is going to be as far as vaccinating for COVID when there is a vaccine. But I think health departments will have some role, whatever it is. So we want to be prepared. And so that's what our Fight Flu campaign is about. But I think back to H1N1, which is what brought me to the Nassau County Department of Health in the first place as deputy commissioner. And one of our most successful events was vaccinating day laborers in front of a very large hardware store. And the first time we showed up, they didn't come near us. They were afraid of us. And we brought some of our team that work in the field, concept of public health detailing, and really just discussed with them and brought flyers rather than our big truck with the big Nassau County logo. And after we convinced the day laborers that we were there to help them, we brought the truck back a few days later, and a few of them got vaccinated. And after that, we went back and people brought their families to us. And so you have to work in public health at establishing trust. And we wrote about it and published it and called it, reaching those hidden communities. And even though we have pharmacies all over and we have 11 excellent hospitals in 450 square miles, geographically, Suffolk's spread out a lot more over, almost 4 times the land. So people look at Nassau and Suffolk and they say, oh, Nassau and Suffolk, same thing on Long Island. They share Long Island. But the fact is, demographically, we're very, very different, even though we're neighbors. And my population density is 4 times higher. He's got all the farms and all the vineyards.
We have deer crossing our roads.
Yes, and he's got the great fishing out in Montauk and all the vineyards and farms. I don't think we have one farm in Nassau County. From a public health perspective, I don't have any communities, any of the Indian communities. I know you've got the Shinnecox, Greg. And so these are public health issues that really separate Nassau and Suffolk. And you can drive a 5 or 6 mile stretch in Nassau and pass 4 world-class hospitals. Yet, even though those hospitals are there, we still know there are people who have a hard time accessing preventive health care. And that's the gap that we're trying to fill in.
Excellent. Thank you so much. Dr. Pickett, did you want to add anything? I mean, Dr. Eisenstein covered a lot of material. You're welcome to add if you would like. For example, the federal qualified health centers in Suffolk County and some of the other ways that we're able to provide very low cost flu vaccination in the county.
Yeah, that's correct. We have a network of health centers. They used to be Suffolk County Health Centers, but they are now operated by the parent companies, Hudson River Healthcare and Peekskill. But for the Long Island Health Centers, they are now called Sun River Health. And so they operate a network of health centers, Huntington Station, Brentwood, Wyandanch, Amityville, Patchogue, Shirley, Coram, Riverhead, Southampton. So we encourage county residents that may have difficulty accessing care or are worried about insurance, immigration status, whatever have you, to access high quality, culturally competent care at our Sun River Health Centers in Suffolk County.
Great. Thank you so much for sharing that. Okay, let's see. Let's turn now to Stony Brook University is a research and teaching university, and we are very fortunate in addition to members of our community, to have aspiring public health and medicine and physician assistants and nursing students and social welfare students from the many different schools and programs that encompass the Stony Brook Medicine community. So we'd like to ask, in your leadership roles and your experience, what advice would you give to the aspiring public health and healthcare workforce about the relationship between health science and policy making as it relates to flu prevention?
You want me to go?
Yeah, go ahead, Larry.
All right, great. Just like Suffolk, give Nassau the hard one. I got it. First, it's funny you bring this up, Lisa, but I was just looking as you were speaking at the attendee list, and I have to give a shout out to my good friend, Dr. Flesher. Hello, Dr. Andy. And I noticed there's a couple of my employees from the Nassau County Department of Health who are students in the program at Stony Brook for Public Health and Health Administration. So hello to them. They're doing an amazing job. And I think that, I had an interesting experience last week, which was I went to my county's budget hearing, which traditionally is one of the most stressful events of the year for me, because you've got to try and fight for the budget, every penny. And public health is something that it's very hard to quantify the care that the illness that doesn't happen when we're successful. And I always say, if we're good at our jobs in preventing disease, people don't get sick. How do you count what doesn't happen? And if you can't count what doesn't happen, how do you bring that to the legislature and say, look, all of this didn't happen, give us money? Whereas if we were surgeons, we could say, look, we did 1,000 open heart surgeries and saved 999 of them. And this is why you invest in what we do. I think that for the first time we went in there, and the legislature was, they're always supportive and complimentary, but it really was just a testament to the work that public health has done. And this is happening in my county, and it's happening in Suffolk too. And the legislature just spent an extensive amount of time thanking us. This is the time with this COVID outbreak that the world has recognized the importance of public health. For all the years, public health got cut. Then an outbreak, a pandemic happens, and they say, where's the public health department? Well, you cut us. So the few people that are left, and this is a federal trend. This is national. Public health jobs in government are many thousands down over the last 10 years. And for those students, don't panic. It doesn't mean there won't be jobs for you. They've shifted to the private sector from government. So people graduating with degrees in public health or health administration, there's going to be plenty of work, but I think we really, as a public health community, have to make sure that one day COVID will be under control, one way or another. It may, I don't know when that's going to be, but there'll be a day. We can't lose the momentum of how important we are. We can't become secondary and the first thing cut anytime there's a budget deficit or anytime there's a budget issue. In infectious disease, people ask me, are you surprised with what happened with COVID? No, because if you look at history, there are viral pandemics every so often. In fact, some of us are surprised that it just took this long. I mean, the fact is, one day COVID will become either completely gone or something we live with like the flu, and then something else will come. It happened with HIV. It happened with Spanish flu in 1918. Since I've been commissioner, there was a year where Zika was all the rage. That's a virus. There was a year when West Nile was all the rage, and we sprayed, chemicals in the air to kill mosquitoes. So I think that from a policy perspective, you have to take the lessons you've learned and keep reminding people. Look, COVID is a deadly respiratory virus. We're begging for a vaccine to come. We all want it. We all need it. Economic disaster is happening because we don't have it. Well, we have a flu vaccine. Let's not take it for granted. Let's invest in getting people to understand why it's so important. The fact is, when people are out sick because of the flu, productivity at a business drops. And if they spread it to a business can have to shut down because of flu outbreaks. There are financial consequences to the flu. There are deaths. thousands and thousands of deaths, somewhere between 35,000 and 80,000 deaths in an average year. This is not going to be an average year. You can't look at the numbers this year for flu and say this is a typical flu year, but in a typical flu year, thousands of Americans die. We can prevent that. And so when it comes time for policies about health, it started with healthcare workers. Should healthcare workers be mandated to have flu vaccines? There are hospitals that if you will not be vaccinated for the flu, you cannot work there. They refuse to have, they say, you don't want to be vaccinated, fine, you can't come in, you can't infect our people. So there is, and then it became the law in New York State that any healthcare worker who wasn't vaccinated would have to wear a mask. And it's funny how we fought over, should we make people wear a mask? And nowadays we look at it like, you know, nobody leaves the house. Every morning as I walk out the door, I always have this routine where I say, wallet, keys, phones. Now it's wallet, keys, phones, masks to make sure I have it all. And, you know, it's just part of our life. But asking healthcare workers in hospitals to wear masks was a big policy battle that we were very happy when New York State passed it as legislation just a couple of years ago. And by the way, it impacted public health too in my department, because we do see people in the community and patients and do HIV tests and that kind of thing. If my employees in previous years did not get flu vaccines, they had to wear a mask at work. So there's precedent for policy. Now we've got to take this horrific experience and turn it into common sense legislation and policy going forward. And the other thing is asking about this, you know, we save lives from flu every year, just like we're saving lives from COVID every year. For the young students or the students who are becoming public health professionals, health administration professionals, this is your time to shine. It's unfortunate. It's unfortunate, but if your health departments and your public health administrators aren't the leaders now, aren't setting the tone, aren't making it clear why flu vaccine is so important, then you shouldn't have a health department. And so as hard as this is, as awful as this is, as much as we miss the way things used to be, nobody should forget the work that public health did now. And that's our mission when this is done, to make sure nobody forgets about us.
Dr. Pickett, would you like to add on the advice to our future public health and healthcare workforce, commenting a bit about the relationship between health science and policymaking?
So I will add to that. Yeah, the one thing that Dr. Eisenstein was saying is that people now realize the importance of public health. I remember when I was working on my master's in public health degree, you know, it's kind of a running joke, like what are these 3 letters you're going to get after your name that are actually going to lower your annual income? And that was MPH, Masters in Public Health. So it was kind of a running joke that you want to do all this good and try to improve the public health of the world. But in reality, you know, when you're looking at the job market, it's not as desirable a degree as some other degrees. Now, I think that with this pandemic, people are seeing the importance of public health. I spent more time with my county executive now, you know, in these last 7 months than I had in the prior 11 years that I've been in the county. And so, you know, I appreciate the leadership on the county level, from the county executive on down, that they all realize the importance of this whole effort we're doing with COVID in terms of case investigation, contact tracing, isolation, quarantine.
Mm-hmm.
These things are really, they make an impact. They allow the economy to open up. And it's all because of what public health is doing. So I'd like to encourage people to pursue careers in public health. But now you know that you're going to be respected, and there should be, you know, a decent job waiting for you on the other side of that.
Thank you.
Also, health disparities exist, in that we're seeing that the way the pandemic has disproportionately hit communities of color throughout this country, that it's important to continue that work and to keep advocating for communities that are underserved, minority communities in Suffolk County. What we call, you know, Suffolk County has what we call areas that are majority minorities, so where the minority populations are more prevalent than the majority population. And so just the importance of working with communities of color and trying to get the message out. And where it comes to the flu, just as I was saying, messaging is extremely important. this fall, but really encouraging people and really making a hard push of the importance of getting that flu shot this year.
Great. And I just want to acknowledge in some of your comments the importance of working with many different facets of community life. So, for example, transportation, food pantries, the public library systems. There's so many partners and constituents that affect population health and access to services that connect communities to the resources that are available to promote their health and well-being. So we all have to continue to reach out to our partners and link and leverage the resources that we have. I also want to build on something that Dr. Eisenstein said. And, we spent the earlier part of the program tonight talking about some of the facts. And now we're going to shift and lean on you a little bit to give opinion. And we'd like to know, do you think the flu vaccine should be mandatory? Do you think it should be mandatory in schools? Do you think it should be mandatory in healthcare settings?
Who's going first? The home team?
I keep going left, right, right.
I'll go first. I have always believed in informed consent around things, even the flu shot. You do have a right to make your own healthcare decisions. And I think the flu vaccine is, something that, well, if, we think that you should get the flu shot. We know it's going to prevent you from getting seriously ill from the flu, could prevent you from dying. I think you should get it, but I would leave it up to people to make that decision to get that flu vaccine or not. So that's where I stand on that.
And I'm going to disagree. And the reason that I'm going to disagree is because A, it would be no fun if we agreed this entire hour. But more importantly, I'm going to disagree because, and I take this back to Jacobson versus Massachusetts, the smallpox case that went to the United States Supreme Court, where Mr. Jacobson refused to get a smallpox vaccine and got fined by the community. And the reason I disagree is, although I agree with informed consent, and I agree people have the right to be injected with something, they don't have the right to get other people sick. And so while I don't know if I would fully say all of society should have to have it to go in public, I think for healthcare workers especially, and it's because of the pathophysiology of influenza. You are fully contagious with flu 24 hours before you have any symptoms. We know that as a fact. So picture a nurse goes onto a floor during normal non-COVID times, just walking in to take temperature, do the most basic things. And the nurse is fully contagious the entire time and can go into 15 or 20 patient rooms and spread disease. Now that nurse may survive, that nurse may be young and healthy, but the people that are in the hospital are there for a reason. And so the reason that I think, especially in healthcare workers, that it should be mandated is not because of their own rights. It's because I don't think they should have the right to give somebody around them a deadly disease. And if people are immune suppressed, even if they're vaccinated, they still can catch the flu. And most of the time it doesn't happen, but they still could die. And so while I don't know that I would make it something that has to be for daily life for all of us to go out in public, I do think in healthcare workers, it should be a mandate because they can spread it to and in nursing home staff where people are more likely to suffer consequences, and especially for people that deal with small children and babies who can't be vaccinated up until 6 months. I think that the risk of spreading a deadly disease, if we can prevent it, I think it should be prevented. We do that in hospitals with other viruses. You can't work in a hospital if you don't have MMR vaccine. You can't work in a hospital if you don't have hepatitis titers. So it's not a new concept. It's just adding to the list. And so to me, maybe, look, this is my job. This is what I do. My job is to get people vaccinated. That may have something to do with this too. Sounds like a Dr. Andy question, by the way. But anyhow, I would say that especially for healthcare workers, I would support a mandate. And I think just the fact that flu is so readily contagious from one person to the other, I think it should be something, if not mandated, should be strongly supported. And that's what Dr. Pickett and I do. We absolutely go around and make getting people vaccinated one of our missions. But, you know, if you want to extend that to COVID, it's a little different in the sense that we don't have years of history of showing that it's a safe vaccine yet. But with flu, we know it's a safe vaccine. We know it saves lives. It's been given billions and billions of times. So the argument that you're going to hear about, well, the COVID vaccine's too new, we don't know, that doesn't apply with flu. We do know. It's not 100% safe, but it's well over 99.9% safe. And so the benefit to society far outweighs it. And the Supreme Court in the early 1900s said, for the betterment of the community, you can mandate somebody be vaccinated. We do it for other viruses. I don't know why we don't do it for flu.
Dr. Eisenstein and Dr. Pickett, another question that came in the last day or so speaks again to the preventive measures that we're taking to prevent the spread of COVID and the relationship to flu. So I want to take a moment to ask you your thoughts on this question. With widespread masking, social distancing, de-densification, and proper hand hygiene, is the flu going to not be an issue? We're good? It's eliminated? Do we need a vaccine?
So. I hope so.
Yeah, that'd be really good to see. You're correct. I mean, these are respiratory viruses. So what you're doing to prevent one respiratory virus should prevent the others as well. So we'll see what happens this flu season.
Yep, similar with some chronic diseases as well. Healthy eating, smoking cessation or no smoking at all, exercise benefits lots of different things. So that's value added, right? Mm-hmm. Excellent. Okay, I have one more question for you because we have 3 more minutes. Many of the attendees are part of the Academic Health Center, and we would love to hear your thoughts on what more we could do in academic health science and medicine and public health to work with you in promoting flu vaccination.
We'd love to partner with you on some messaging, maybe get some things out on social media, probably some posters out. You know, try to put some things up in underserved areas. I think that would be a win-win right there. Yeah, partnership, definitely.
Great, thank you.
And I think, you know, you have a lot of students who tend to be on the younger side, not all of them, but tend to be very savvy with the technology and the social media. I know my teenagers can run circles around me with their technology capabilities. And I think that this is the sort of thing that students can make fashionable. Getting vaccinated is something that can become a cool thing if videos are done and people who've never gotten a flu vaccine suddenly see one of these TikTok things. I'm not really sure what that is, but my kids talk about it all the time. If there's suddenly a cool TikTok that millions of people are watching that points out why they should be vaccinated by the flu, that's a great victory. And the fact is that doesn't have to happen on such a large national scale. It could happen locally. I'd love, as Dr. Pickett said, love partnership, would love to see local communities take up the mission of making flu shots cool, of making vaccination a hot topic. And of the people that tell me they're not getting vaccinated, it tends to be younger people. Oh, I don't get the flu vaccine. Why? I just don't. And I very often see that in 20s and 30s. And, you know, once you get older, you realize flu can really kill you and will if you're not careful. But I think that getting the message out shouldn't only fall on our 2 health departments. Everybody can help get that message out.
Great. Now, public health and public trust go hand in hand. Where should people leaving this program tonight go for health information that they can trust?
We have a lot of information on our website, suffolkcountiny.ny.gov. If you check in the health department, we have links for COVID-19 information, as well as information on where to get health care and information on where to get a flu shot. So that's definitely an underutilized resource that you should take advantage of. www.suffolkcountiny.ny.gov.
Great. And Dr. Eisenstein?
Yeah, and I think that you know, you can go to the local county health department websites. I think, though, that also New York State Department of Health has a comprehensive website. The CDC has become controversial for different reasons, but the fact is it's still the mecca of all things infectious disease. Most of the people that work there are incredible. The NIH information has great websites. The FDA has really good website information regarding, for example, COVID testing. If you want to fully understand COVID testing, go to the Food and Drug Administration. So the one thing I would say is get your information from a reputable source. There's going to be a lot of opinion even in the reputable sources, but it's sometimes, you know, you start to see, especially if students do a report, they got, you know, their information from, you know, Joe's podcast. Who's Joe? I don't know. You know, that's not necessarily a reputable source, but when information is coming from the agencies that have lifelong career people who work in infectious disease and epidemiology and public health, most of the messaging that comes out of those places is reliable and tends to be the best. Our county health departments have excellent information. New York State Department of Health website has excellent information. Most of the CDC information I stand by. And so just make sure it's a reputable source is my advice. You don't have to agree with everything. They don't agree with each other all the time. But
we have a slide that will be shown in a moment that provides website information for each county on the resources for flu vaccines. The CDC has a flu vaccine finder. You just type in your zip code. And I did this myself before the program this evening, and over 30 flu vaccine access points came up in my zip code. So it's very easy to use. And also Stony Brook Medicine has created a Flu and You, What You Need to Do resource page that also includes helpful information. And we'll be building on that with additional flu vaccination programming over the next few weeks. Thank you both for your time. Thank you for having this conversation with all of us and answering our questions. We thank you for your leadership and the heroic work that you have taken on over the last few months to get us through this most challenging time in our history. Thank you both so much. Good night, everyone.
Good night. Thank you.
All right, thank you.